McDonald also provided an update on how the town as a whole is faring with COVID-19 and what is driving the uptick in cases.
Many residents may have seen media reports about a COVID variant originating in the UK that is far more transmissible than the normal strain of COVID-19. Over the weekend, I believe it was Monday afternoon, Massachusetts Department of Public Health announced the first confirmed case of the new COVID variant in Massachusetts itself. There's still a lot of data that's coming out about this new variant, but the general understanding right now is not, there's no indication that it's any more lethal, so you won't necessarily get sicker when you if you contract it. However, it is far more transmissible, as much as 50% more transmissible. So that means it spreads far more easily. That's something for residents to really keep in mind because we have an incredibly high volume of COVID cases in the community right now. Needham is technically in the yellow, which is the moderate risk category the state has established, but we're at our highest positive testing rate so far. We are at our highest average daily cases per 100,000. We've gone over 50 average daily cases per 100,000. Our positive testing rate is climbing near 4%. So we're very concerned about the number of cases in Needham. And we hope residents can really try to modify some of their behavior to take it seriously and to try to take steps to make themselves and their loved ones safe. A lot of the steps are things that they've already been told, but it's hard to keep up vigilance, 100% of the time. Sometimes people relax a little bit, and that's totally understandable. But both because of the spike in cases and because of this new COVID variant, people really have to double down on how closely they're adhering to the guidance, making sure they're masked at all times, keeping that separation, really thinking about whether the activities they're doing are essential or whether they're discretionary, and if they're discretionary, whether they really want to do them. Because unfortunately, no matter how well you prepare, even if you try to keep 6 feet from people, even if you try to have your mask on all the time, there's still some risk that comes with running errands. There's still some risk that comes with being in indoor settings with lots of people who aren't in your immediate social bubble, your immediate household. So I really hope that residents will take that seriously. Needham has been fortunate. Needham and a couple communities in the Metro West region are in that moderate risk category for the state. Most of the rest of the Commonwealth, more than 200 communities, are at high risk level. And Needham will follow those communities into the high risk level if residents don't take seriously the steps they need to reduce the spread of COVID. The biggest driver of cases in the town of Needham is household transmission. So that it's clusters of cases revolving around people's household or their immediate sort of family circle. We were at our highest positive testing rate that we've been over the course of this pandemic. We're at our highest rate of average daily cases that Needham has ever been. It's more than 50 average daily cases. By contrast, over the summer, we were at between 2 and 4 average daily cases per 100,000 population over a 2-week period. Now we're at over 50, 52. That's a huge increase. And the way people can try to keep themselves safe are some of the steps I've talked about. When we think of household transmission, what we're thinking about is people unfortunately making some poor decisions and then bringing COVID into their household. So it's a young person hanging out with a bunch of their friends without a mask on and getting COVID and bringing it back into their household and infecting their parents or a sibling. It's a parent who maybe is not as careful with their colleagues at the workplace around lunchtime and contracts COVID and brings it back into the house and affects their spouse or their children. It's those sorts of interactions that are driving the spread of COVID in Needham. There unfortunately is not, you've seen media coverage of this congregation had a very large mass and a number of people got sick. That hasn't happened here in Needham. The congregations have been incredibly responsible. You've seen in other parts of the country, this restaurant was responsible for the spread of COVID. Needham restaurants are very responsible and the state has pretty strict guidelines. They haven't been a source of the spread of COVID in Needham. What really has are household transmissions. There are some sort of caveats to that. There is some transmission that we found in daycares. It is generally controlled, but that is a challenging environment. Obviously, the nature of kids that young, it's hard to have masks on. There also has unfortunately been some transmission in long-term care facilities and nursing homes and assisted livings. And that's obviously a real cause for concern because generally the inhabitants of those places are the most at-risk type of folks, both based on their age, medical condition, as well as the type of setting where they're in a fairly small space confined. But those two categories are very small compared to the household transmission in Needham. So those household clusters are really how we can bring the rate of cases down in Needham. And It's up to each individual person to make smart decisions about their actions and the actions of their family. And that's how we will keep COVID from spreading.